Good afternoon, everybody, and thank you all for joining me today. I'm William Jenkins. I'm the Interim Director of the City Institute at York University, and I'm joining you from my home office, as I'm sure many of you are as well, in other parts of Ontario and perhaps elsewhere on the continent or in other parts of the world. And I'm doing so mindful of the privilege that we have to be able to sit on a chair and do this, and be also mindful of the labour and the efforts and the persistence of those who are not able to do these things on an everyday basis now, whether we're talking about those working in the essential healthcare capacity in that sector, in the areas of transportation, communications and infrastructure, food supply, education, the list goes on. So thank you for joining us for this opening seminar of the City Institute's annual speaker series. And although our present circumstances are unfortunate, we are pleased to be able to bring this series to you in an online capacity. And although we are not gathered together in the same location at York University right now, I'd like to acknowledge that many Indigenous nations have long-standing relationships with the territory upon which York University campuses are located that precede the establishment of the university. York acknowledges its presence on the traditional territories of many Indigenous nations, and that this territory is subject to the Dish with One Spoon Wampum Belt Covenant, an agreement to share and care for the Great Lakes region. Today's session is entitled COVID-19 in the City, Centres and Peripheries, and we have three speakers in order: Keil from York University, Samantha Biglieri from Ryerson University, and then Harris Ali, also from York University. We'll then follow it up with a question and answer session. Keil is a professor in the newly minted Faculty of Environmental and Urban Change at York. He is a former director of the City Institute, principal investigator on a project on global suburbanisms, and currently working at the intersection of global urbanization and infectious disease. Professor Keil has previously conducted research on SARS and the Global City Network with our third speaker, Professor Harris Ali, resulting in a much praised volume entitled Networked Disease, Emerging Infections in the Global City. Professor Keil's remarks will focus on spatial aspects of COVID-19, speaking directly to our title in many respects, while also addressing planning issues, urban design issues, and our shifting experiences with place and space in the urban region. Samantha Biglieri is an assistant professor in the School of Urban and Regional Planning at Ryerson University. As an urban planner, her research uses critical approaches at the intersection of planning and health well-being, focusing on built form, housing, care, older adults, and people living with dementia. Professor Biglieri is currently collaborating with Professor Keil and his colleagues, examining the governance of COVID-19 in the Milan and Toronto regions. And her future work will examine the experiences of new Canadians living with dementia in Scarborough, Ontario. Her research has been featured in academic journals, the Canadian Library of Parliament, international conferences, books, and on CBC Radio. And Professor Biglieri's remarks will deal with the experiences of older adults during the COVID-19 pandemic, especially in the periphery of the city. She will discuss the use of storytelling in her research and the question of how care can be used as a lens to examine everyday life during the pandemic, and especially in the area of policy development. Harris Ali is in York's sociology department, and he studies the social and political dimensions of disease outbreaks. He has studied different types of infectious disease outbreaks in various parts of the world, including the outbreak of waterborne E. coli in Walkerton, Ontario. And with Professor Keil, he has studied the outbreak of tuberculosis among the homeless in Toronto in the mid-2000s, as well as a comprehensive study of the outbreak of SARS in Toronto and other global cities such as Singapore and Hong Kong in 2003. He has more recently been engaged in research on community-based responses to Ebola during the 2014-2015 outbreaks in West Africa and more recent outbreaks in the Democratic Republic of the Congo. He is now looking at how the Ebola response has influenced the current COVID response in Africa, and is currently a co-principal investigator with Professor Fuyuki Kurosawa on a project investigating the role of social media in flaming and countering anti-Asian racism during the ongoing COVID-19 response. Professor Ali's remarks will deal with the relationship between inequality and forms of scrutinization affecting different segments of the population during the pandemic. So I want to thank our three speakers, and we'll begin with Professor Keil.
Thank you, Willie, for the kind introduction, and hello to everybody who's listening. I'm really happy that we could do this. I want to acknowledge first some acknowledgements in the beginning. This is not my picture. All the other pictures I'm showing are probably my pictures. This I stole from The Economist, but I think it's an excellent cartoon representation of where we find ourselves after so many months of COVID in the city. And I do want to acknowledge this moment as not being early in the pandemic, but one that is almost 11 months into 10 months at least into the pandemic. And this is not the first time that you who are listening and myself who is speaking right now and all the others who are going to speak will address this issue. They're interesting to me is when I prepared these slides, I remembered that in November of 2019, I was on sabbatical in Australia. I gave a talk about emerging constellations of disease in an era of extended urbanization. And just a few weeks later, I gave another talk in Melbourne with Jody McVernon and Michele Acuto on exactly that same topic about emerging infectious diseases. At the time, it seemed like an academic topic, something that you do because you are so specialized that you only have a few people to talk to in the world. No mass audience, nobody could really experientially follow what this was all about. 2 weeks later, COVID-19 or the SARS-CoV-2 virus was detected or published, publicized at the end of December 2019. And in the beginning of January, the middle of January, Harris and I started to give our first interviews. At the time, most of them about the reappearance of anti-Asian racism around this particular virus, which at the time seemed to be clearly coming out of Wuhan, which probably it did, but it was laced with all kinds of anti-Asian racism at the time. That is in January. In 5 months ago, in May, a big statement was made by some well-known urbanists, Jenkins, Kwame Mackenzie, and Richard Florida. Canada's new normal begins in our cities. We all thought at the time we knew what that was. Just yesterday or 2 days ago, The Lancet, one of the leading medical journals in the world, wrote an editorial, a very forceful editorial, powerful editorial, in which they said it is time to forcefully impress on people that basic measures to limit the transmission of SARS-CoV-2 are here to stay. This is the new normal. We're still talking about the new normal 10 months into the pandemic. I'm going to talk a little bit about some synthetic ideas that I've had over those last few months, and that is based to a large degree on a phenomenon that I think also needs to be acknowledged, which is the fact that even though we're all sitting isolated in lockdown, many of us have found new modes of collaboration, cooperation. Harris and Samantha are part of that for me, but also several others that I have found to cooperate with over these last few months, which was to some degree one of the ways in which we intellectually and personally survived. So my comments today are based on a paper that's going to come out in BISP, in the planning review in December, and I'll be happy to send that link if anybody is interested. So having said this, let's first say what many of us might agree on, the ones that I've collaborated with, and I hope that Sam and Harris will agree that these are some basic things that we have found, is that we first live all in an urban society, And the diseases we deal with today are diseases of that urban society. And secondly, the urban is not the distinction of a collection of distinct towns and cities, but it is an extended form of urbanization that's built social natural environments that are connected through urban lifestyles and priorities shaped by urban life's demands and needs. And thirdly, it is in this urban world where local and regional jurisdictions remain important. It's not all the national state, even though it sometimes appears that way. And fourth, urban society produces new types of social conflict and politics, which will demand responses from authorities far and wide. And it's important to say that over the last few months, of course, it hasn't always only been about the politics of the pandemic. We have seen that the intersections with climate change matters, with Black Lives Matters, have led to new horizons of action. And of course, all of this is now overshadowed by what's going on in that election south of the border. Cities are important. They are important in the sense that we talk about them as municipalities. These are just two impressions from yesterday. Our Prime Minister here in Canada, Justin Trudeau, spoke yesterday with Bonnie Crombie, the mayor of Mississauga. And Chancellor Merkel in Germany also yesterday, or today actually, is speaking with the mayors of the 11 largest German cities. And so governments have been trying to keep up the communication and bring cities as corporations into the conversation, very much so. So there are all kinds of questions we could ask, all kinds of intersections that we see in cities and infectious disease. It is a symbiotic relationship historically. One makes the other, but how? How do cities shape disease? How do diseases shape cities? Can we talk about a health penalty that we have to pay in cities, or is it the other way around? Are there benefits? Does urbanization cause outbreaks of emerging infectious disease, or does it hinder outbreaks of emerging infectious disease? Is density good or bad when pandemics hit? I'm not going to get involved in that one today. It's a big topic. How do outbreak response and pandemic preparedness work? And can cities be pandemic proof, and for whom are they pandemic proof? And all of those are empirical questions at first glance, but in reality, they are also conceptual, theoretical, methodological issues, and in the end, political questions that we need to ask and answer in that particular way. So today, as I said, for what I have left, I will talk a bit about the space and not so much about the time, but more about the space that a pandemic makes. We know that urban planners and designers, practitioners, many of us do understand ourselves as such. We grapple with literal and metaphorical blueprints of urbanism beyond the pandemic, which means that we need to draw up maps, visions of what we're going to do when, quote unquote, this is all over. The debate here has been shown to be wide open. There's a lot going on one side where people say now we have to blow it all apart and think about the city in new ways and make realize new visions. And on the other hand, there is the opposite, and people say let's just continue the way it is. So this is an ongoing debate, and there are a lot of gray spaces between those two sides. One of the things that has been a lot on my mind is how we can see COVID-19 through an urban lens, which I have discussed in another paper with colleagues. And this is often being discussed right now on a register of progress and modernization. Look at the vocabulary that we're using about reopening post-pandemic. It's all about the idea that somehow we're going to jump out of this into that same stream of progress and modernization that we think we came from. But there are also others who are more modest and bring in questions of preparedness, prudence, persistence, and repair, who think about the city as something other than a product of modernization in that classical sense. These are some of the other topics we can bring up about the central and the peripheral densities, good or bad. I said I was not going to get into this. Urbanism as linear progression or urbanism as repair. Global cities with capital letters, or global urbanization of ordinary cities around the world. Then debates about formalities and informalities. One of the issues that Harris and I are currently working on is to what degree, the formalized healthcare systems in the North, relate to what's going on in informal settlements in Africa, where we do some research. And then questions of insides and outsides. And here I want to bring back just for 1 minute this idea of network disease and what Harris and I worked on when we studied SARS and the outbreak of SARS here in Toronto and in Singapore and Hong Kong in particular. And I would just like to say that SARS 2003 exposed the exoskeleton, the outside of the global economy through the global city system. It was like, a shell in which the global economy could be seen. It revealed itself. But COVID-19 in 2020 exposes the flesh and bones of global capitalism. And here's a Chinese scholar who's a writer who said that Wuhan is one of the newly discovered inner lands of the global production chain, as the Chinese coasts have become more expensive. So we're not talking about the outside anymore. The global economy is not outside. Wuhan is not somewhere else. Wuhan is an inner land of that economy. So we have very much now experienced what it means to live in one world. That doesn't mean we all are the same or we all have the same experiences, but that experience was brought home now. That was not yet the case in 2003. I think that's an important thing. So another difference that I would like to make is that we can look at space as a matter of scholarly contemplation. Almost every journal in our field has now done editorial statements. Here's one from Territory, Politics and Governance, where we now think about those terms that define our field: the urban, the regional, territory, politics, governance, geography. We're thinking about those in different terms, and that'll keep us busy for some time. But it's also space, of course, is a matter of pragmatic pandemic response. We all know how long 2 meters are. Even those who think in feet now know how long 2 meters are. Even the raccoon here knows what 2 meters are. This social distancing rule gives us a new grammar, a new spatial grammar with which we automatically, now when we go to a supermarket or anywhere else, we automatically live in that world of pragmatic response. So we say, that COVID-19 has to be repositioned at the peripheries of our urban society, and that urban society, or that periphery, is not just an analytical category, but it's also where most of the invisible, vulnerable people often live and work. It's very important for us to realize that, and a lot of people have now realized that that is the case, and we need to pay more attention to what goes on there. When COVID-19 arrived, it mattered where in the city you lived. It still does matter. And out of those 900 infections that we had today in Ontario, I would like to know where these people are, where they work, what kind of lives they live. We need to understand that better. So we have intersectionalities of racialization, poverty, other forms of marginalization, with a location, that's the geography, the urban aspect of it, of, for example, the Toronto region. And that has shown catastrophic vulnerability in many cases. So finally, with my last slide, I want to go to one of those places. I'm not going to go to the northwest of the city of Toronto, which is the hardest hit area in the city of Toronto. I want to go to Brampton, and I want to demonstrate so here just to show, there's a very interesting debate going on. Mayor Patrick Brown, who is a conservative himself, said that the pandemic like this lays bare the socioeconomic inequalities. It's not often that you hear a conservative talk about inequalities. But now even a mayor, conservative mayor, is forced to account for that, to talk about that. He much rather likes to talk about how great Brampton is, but now he talks about some of the things that are going wrong. So the city, Brampton, has had significantly less health funding. And I should say to those who are not from the Toronto region who are listening, Brampton, Mississauga, and the region of Keil, and together with the city of Toronto, has been the most affected area in Ontario, the province of Ontario, together with Ottawa, and one rural area in the southwest of the province. So this city, Mayor Brown says correctly, has had significantly less healthcare funding before and during the pandemic than comparable cities. Fewer hospital beds, fewer testing centers, fewer tests, longer waiting times. Brampton is vulnerable due to its residents' dependence on a nearby international. Now this is interesting. This is something that Mayor Brown added to those facts in a statement that he made on the CBC a couple of weeks ago, where he said that Brampton is vulnerable due to its residents' dependence on the nearby international airport's jobs, the particular exposure of workers in the city's trucking industry, and on account of the fact that its large immigrant population is connected through international flights to places far away, and the preponderance of multi-generational households in immigrant communities. And then he adds, moreover, outbreaks at workplaces, a chicken processing plant in Brampton in May, and an undisclosed factory in the neighboring city of Mississauga in September demonstrated another aspect of vulnerability that the suburban community has been experiencing. To put this in these terms says in many ways all the right things. It shows how Brampton is, like Wuhan, part of an inner world of globalization through its large immigrant population, its significant location next to the airport, its involvement in vulnerable industries. All of that is true, but the way we talk about it matters. So as Patrick Brown mentions this about his community, members of that community have pushed back and have said that we cannot have the focus here on alleged cultural characteristics, such as multi-generational living and diaspora travel, because these could be distracting and are probably racist. And those community members have instead emphasized the conditions under which these communities live and work, especially the structural underfunding and their lack of access to necessary services. And this is where we have a debate. This is where we need to find out how we live in our cities, how we talk about our cities, how we talk about each other. And that is what I want to leave you with, and we can take these topics up perhaps later in the discussions. Thank you very much.
Thank you very much, Roger. And now we'll hear from Samantha Biglieri from Ryerson University.
Thanks, William. And thank you so much for pronouncing my last name properly with the Italian Biglieri. I really appreciate that. So today I'm coming to you from a view from the Kneff Tower. I feel really lucky to be back here at York. I was previously a postdoc just in the early winter of this year. And I had the opportunity to teach some awesome MES students. So I'm very happy to be here again. So as Willie said, my research focuses on planning and health well-being, specifically looking at older adults and people living with dementia. I'm also president of the Toronto Council on Aging, a nonprofit based here in the city of Toronto, and we focus on civic engagement and education. We do a number of things like engage older adults in discussions about issues that affect them at all levels of government, deliver programming, as well as conduct research in partnership with universities and other nonprofits. More on that later. Today, I'm going to talk to you about older adults in the COVID-19 pandemic, specifically their location at our social and spatial peripheries. And I'm going to be blending my current and ongoing work with my experiences with my grandma, I call her Nanny, who lives in a retirement home, as well as my work with the Toronto Council on Aging. And if I can figure out how to move the slide, here we go. So here's just a quick agenda for what I'm going to cover today. I'll start off by setting the stage with some data and information that you might already know about older adults living in community and congregate care. Then I'll touch on broader sociocultural political structures that influence what's currently happening and propose a potential way forward through the telling of stories and using care as a lens through which to view everyday life in the social and spatial periphery. So let's set the stage. Like Roger said, urbanization is one of the biggest changes, suburbanization as well, in our lifetime. And the second one is population aging. In Canada and Toronto are no different. In 2015, the number of people over the age of 65 outnumbered the number of people under the age of 14 in Canada. And when we talk about COVID-19, we know that older adults are one of the most likely to be vulnerable to dying from COVID-19. Many people talk about the vulnerabilities that older adults face, but I would caution us to recognize that older adults are a very heterogeneous group of individuals. So that being said, let's look at yesterday's numbers from public health. So what we can see here, and this was just yesterday, as of October 3rd, the data, the infection rates are higher in these lower age groups, but when we look at who is dying from COVID-19, it's disproportionately folks over 80 and folks over 70 years of age. Now, like I said before, aging is heterogeneous and it depends on a variety of different factors. At the individual level, things like age, socioeconomic status, race, immigration status, chronic health conditions, sensory, mobility, cognitive impairments. Other contextual factors that influence this experience are forms of structural oppression like anti-Black, anti-Indigenous, anti-Asian racism, sexism, ableism, homophobia, transphobia. It also has to do with where you live and the kinds of support systems that you have, the access to infrastructure, access to amenities and healthcare. Basically, what I'm trying to say is older adults are not homogeneous. They have diverse lived experiences. And what we know about COVID-19 is that it's disproportionately affecting older adults, but also folks who are poor, racialized, and new Canadians. So just wanted to show you a couple of maps here drawn from the City of Toronto's well-being mapping. So if we look at older adults 65 years of age and over, red is the more concentrated portions, and here's 85 and over. And when we look at these maps, we can see that there are pockets in the city where we have a higher than average number of older adults, and it seems to be that they're more in the peripheries of Toronto, for instance. Previous work I did with a colleague by the name of Max Hart at Queen's University, we found that older adults living on lower incomes and living alone, nearly 90% of them in Toronto live in car-dependent environments. This means that it might be harder for them to access services and amenities, and this was already an issue before the pandemic. In the community with lockdown measures, community program for older adults suddenly closed. But this is when several organizations launched into trying to figure out ways to broach that physical distance, as well as help older adults get what they needed. One example was UHN Open Lab, which is a program that's still running, and they match older adults living in community housing with volunteers who will pick up groceries and medicines for free of charge. This is still ongoing. Another example is what our organization, the TCA, did. We started off with friendly phone calls to our members, asking them what they were worried about and what they wanted more information on. What we heard from a lot of people was that they were trying to find ways to stay connected, get good information to stay safe, and to have things to do. And so we created a bunch of webinars in response. We had a webinar about how to resolve tech issues. We ran a Q&A with the Deputy Medical Officer of Health in Toronto, our therapy session, and next one is about telemedicine. But here's the thing. Many of the needs of older adults also remain the same. The need for affordable and accessible housing and public spaces is still there. Most people we talk to still want to remain living in the community and did not want to go to long-term care. In fact, I was listening to a panel yesterday, and Dr. Samir Sinha, who is someone who's very involved in these issues, said they ran a study and 99% of people do not want to go into long-term care over the age of 65. This raises discussions that we've been having for a while, and that is, how can we create an environment that someone can age in community in a safe and successful way? Now, moving to congregate care settings. This is what Jay Pitter calls forgotten densities when it comes to thinking about COVID-19. These are headlines that I'm sure are very familiar to all of you. We know that over 80% of deaths from COVID-19 have happened within long-term care across Canada, There have been damning reports from our Canadian military, lack of access to PPE, staff shortages and burnout, families being barred from seeing their loved ones. And I think the headlines here capture a lot of those sentiments. And I want to show you another map. Again, this is from October 8th, so yesterday. These are homes, long-term care and retirement who have either resolved an outbreak or were not affected. And these are the homes that are currently in outbreak across the GTA. And what we know is that geriatricians like Dr. Stahl, Nathan Stahl, Mount Sinai, has said that the best thing to do for long-term care is to stop community transmission. And the Ontario Ombudsman recently came out with a report that recommends a couple of different things for the second wave, including making all homes have contingency plans, changing visitation privileges, actually allowing essential family members in with proper infection control, having dedicated communication resources for families, as well as enhancing whistleblower protections. This is where I'm taking you to my own personal experience. So in case you haven't been in a retirement home or a long-term care home lately, this is the retirement home that my nanny lives in. And this is the scene that we saw when we first went to go see her. There are a number of signs. There's a survey to fill out. We had to wait 20 minutes in the lobby, and then we had someone come down, check our temperature, and take us upstairs to a random room in the home in order to see my nanny. And this is the room that we were taken to, and we were allowed to see her for 30 minutes. We weren't allowed to go to her room to find the remote control that she apparently has misplaced, or her wallet. Something else that I noticed, and she's had Alzheimer's for a decade, is that her language and her mood has deteriorated since I had the last opportunity to see her in person, which was in February. And that's something that all kinds of folks have been saying, that their loved ones are deteriorating because they haven't been able to visit them. And when you're on lockdown, it's a huge limit of social connection. And in the US, they actually think a spike in dementia-related deaths are because of this isolation and loneliness. However, we did get to have a lovely half an hour flipping through a photo album with my nanny, and I feel incredibly lucky to have gotten to see her and to know that she is safe. And I think that is a great privilege, and this is a home that hasn't had an infection. So here's the thing. What's happening now is not new to folks who research long-term care. It is not new to families with loved ones in long-term care. The thing is that we have a history of disinvestment in these places, and now it's on the global stage. The system was already plagued with issues like not having enough beds, long waiting lists, old facilities that still have 2 to 4 people in one room, regulations that stifle innovation in relationship-centered care like food and as well as other integral aspects of care like food and recreation, and of course, a precarious and undervalued workforce, primarily made up of racialized women who are new to Canada. Further, there has been research documenting the increasing privatization and financialization of long-term care and retirement homes and how this impacts care outcomes. So what do these issues have in common? What we invest in, this is a lot about what we value. And this goes for municipal, provincial, federal governments, and how we as a society hold our decision makers to account. The tragedy playing out for a second time in long-term care is a result of that disinvestment and a history of not valuing older adults and disabled folks in our society. Many critical gerontology scholars point to these broader structures that dictate who deserves funding and resources. Ageism and ableism both talk about how we value someone is based on their economic productivity as opposed to their value as a human being. And it's discrimination based on age and disability respectively, and it's reared its ugly head in popular phrases like boomer remover and other awful things that I'm sure you know about that Donald Trump has said about older adults. As disability justice activist Mia Mingus writes, ableism is connected to all of our struggles because it undergirds notions of whose bodies are considered valuable, desirable, and disposable. And it's these things that shape who is at the social and spatial periphery. From my perspective, one of the ways that we can combat these broader issues is through asking older adults and disabled folks about their lived experience and how they think things can change. In essence, I'm talking about people telling their stories. This is the kind of work I'd been doing before COVID-19 hit. I spent a significant number of time working with people living with dementia, trying to understand their experiences in the neighborhood, as well as their experience in the planning process. I used a couple of different ways to understand lived experience, making changes and adaptations as we went along. We did things like interviews about their history and connection to their neighborhood, go along walking interviews through the neighborhood, travel diaries, GPS to understand where they went, as well as taking photographs. We ended up learning that people living with dementia are not only supported by their neighborhoods, but they also support others in those neighborhoods. They've created these new routines and ways of living to suit their new lived realities, adapting to their new normal day after day. And it's understanding these innovations, these ways of living. It's something that disabled folks have been doing forever. It's figuring out ways to exist and thrive in a world that was built for a normate body. The normate, as Garland Thompson called it, is likely a 30-something white, able-bodied, heterosexual, upper-class man. And the thing is that the cities and systems we live in are mostly made for that normate body and we institutionalize bodies that don't fit. But by listening to and engaging with older adults and other equity-seeking groups, I really think we can challenge this. And for this, I turn to scholars who've talked for a long time about the multiple sociospatial relationalities that exist between our bodies, human and more than human others, built environments, communities, and these broader structures. I also call on the work of colleagues who see care as multi-directional, as opposed to care being between me, the caregiver, and you, the care recipient. And it also calls on us to see all people as interdependent, rather than this individualistic notion of independence. Again, this is an idea already been put forward by disability scholars and activists. So with this in mind, I created this diagram to help us as practitioners, researchers, and activists to think through how someone is involved in these complex webs of caring. And how does this apply to COVID-19 and the places we live in? Roger and I, along with our colleague Lorenzo Davidovich, propose that COVID-19 is redefining how we see cities and health, and we need to look at the urban region from the periphery. And we call for using a care lens as a way to understand this. For instance, we can ask questions like, are people able or not able to care for their bodies through hand washing, through access to PPE, through access to groceries? How do folks care for their family and friends? How do they check up with them, make sure that they're doing okay? How do groups organize and take care of others? Think caremongering mutual aid groups, or campaigns to keep rent or prevent evictions that are happening right now. How does built form and infrastructure care for us or not care for us? Through overcrowding, homelessness, usable balcony space, access to green space or lack thereof, the fear of being over-policed in that kind of green space, access to amenities and infrastructure. You might also think, how are different levels of government being careful or careless? Who do aid packages support? Who's an essential worker? What does public health messaging look like? A little bit of a mess over the past week. And then finally, how do these macro level sociocultural political structures influence these relations? How do ageism, ableism, sexism, racism, and class, how are these different kinds of structures producing life and death situations? And for us, I really think we need to ask a combination of these multi-scalar, interdisciplinary questions to really capture the complexity of COVID-19 in our peripheries and in our cities. And we need to not only examine the inequitable distribution of infrastructures and COVID hotspots and the processes that led to it, but we really need to meaningfully include the voices of folks who are most impacted, as well as ensuring we don't reproduce these inequities in the process of rebuilding and now in the second wave. And I will end it there.
Thank you very much, Sam. And I'm sure I speak for everybody in wishing our nanny the best. Our final, last but not least, speaker will be Harasali from York Sociology.
Hey, thank you, Willie, and the city staff for organizing this talk today, and Roger and Sam for their talks, and everyone else for joining in today. What I want to talk about today is about the political and public response in the time of the COVID-19, and what it says or what it reveals about the relationship between inequality and urban life. Now, to begin to talk, as I usually begin these health talks, I start with this classical epidemiological triangle or triad. And I think this is important because, outbreaks, pandemics, they just don't occur out of nowhere. They don't occur in a vacuum. Certain circumstances and conditions have to actually coincide for an outbreak to occur. And that's what this triad represents, okay? There needs to be a coincidence between a viral agent and a host who could carry the agent, and a conducive environment which allows the agent and the host to meet up with each other. Now, usually the scientific type people, they focus on the biophysical environment, things like humidity and climate and weather conditions and things like that. But I think there needs to be an expansion of the idea of environment to consider the social environment, okay? Because, for example, there are certain biophysical conditions for the transmission of tuberculosis. For example, crowded conditions with poor ventilation, okay? Now, what if there's certain policies made by society, for example, to not invest in shelters, to allow dilapidated shelters to continue, to not invest in having proper ventilation, to have people crowded together with many beds in a small, tight location? These are all social decisions, and yet they lead to very dramatic results, a disease outbreak, in this case, tuberculosis. Okay, so really, all these public health directives that you hear about, like hand washing, like the wearing of masks, and of course, I'll talk about a lot today, physical distancing, what all these directives do is that they're geared to breaking the sort of arms of this triad, to make it a disconnect between agent and host, so that you break the chain of transmission. That's basically what we're talking about here, breaking the chain of transmission. So what is this? That there are 900 new cases in Ontario last Friday. Somehow the chains of transmission are not being broken, particularly in the suburbs, as Roger has talked about, Mississauga and Brampton and the Peel, where I actually live and I'm talking from now, right? And many of the sort of messaging from the officials, public officials, are admonishments for people for not following the physical distancing rules, right? But there's an assumption here that I want to question, an assumption of agency, that people can simply voluntarily follow the rules to physical distance. Is that the case? Because as we look into this question, if physical distancing is possible for all in an equal manner, we start looking into the questions of inequality. Inequality on different axes, based on gender, based on race, ethnicity, based on social class, based on age. And these are some of the things I want to look into as we go on, okay? One of the things when we did the SARS work, Roger and I, we came across this sort of approach that said, the nature of cities has changed, so that the borders between cities are more impermeable. They're more permeable. They're more permeable to different types of flows between people, information, cargo, capital, and of course, viruses, right? And we were particularly interested in the relationship between permeable cities, the global cities of the world, because, as I'll talk about momentarily, SARS spread through the global cities network, this network of permeable cities. But for this presentation here, I think another way to talk about permeable flows into the city and out of the city is not just between cities, but between the suburban areas and in the city core, and from the city core to the suburban areas, because we can talk about that flow through the permeable barriers as well. And if you look at it that way, you can consider, for example, during SARS, there are outbreaks, big outbreaks in Scarborough Grace Hospital and North York General Hospital. These are suburban locations, right? So you can start talking and looking at the things like the urban health penalty, which Roger mentioned. And, the urban health penalty looks at things like, poor sanitation or overcrowdedness or poor environmental conditions in their city. You know, things like environmental justice issues and exposure to toxic land uses and things like that, you know. And there's been a lot written about it, and also the benefits of living in a city, like world-class hospitals and stuff like that. And as Roger said, quoting Patrick Brown, the hospitals in the suburbs aren't that resourced compared to these sick kids in Toronto General and Mount Sinai, you know, very famous world-class hospitals, right? But, you know, previously I did stuff on Walkerton and the Ebola outbreak, and I said, is there really, you only talk about an urban health penalty? Because you can also talk about a rural health penalty, about lack of investment to those communities which have a small tax base that can't really invest in public health infrastructure, for example, to keep the water clean, and especially during the time of Mike Harris under neoliberalism. So there is actually a rural health penalty too, right? So I think today we can also talk about suburban health penalty, right? And in terms of, you know, homelessness is usually associated stereotypically with the inner city downtown core, but now you have whole homeless families in the suburb. You know, I've seen them, you know, close to where I live even, right? So there are certain other aspects associated with the suburban health penalty that we can talk about today, okay? Now, you can talk about region or sort of rural-urban differences, okay, and inequality there, okay? So I found this interesting. I'm sure that many of you heard about the plight of the migrant workers, you know, from Mexico and other parts of Latin America in the Niagara region, a kind of more rural setting, so to speak, you know, and the cases of COVID that spread there. Okay. Now contrast that with the case of Singapore, world-class, global city, rich, a lot of money, a lot of resources, but they too have migrant workers to build the city, to build the infrastructure, to build the buildings. And these are the Tamil migrant workers. Now look at the conditions that these people lived in their dormitories. It is comparable to the Mexican migrant workers in the rural areas. So the question I asked before, you know, physical distancing, agency, who can practice physical distancing? Who has the agency to do that? That is a question that interrogates the whole issue of inequality, right? So as I alluded to before, you know, SARS spread through the global cities network, you know, and it came from, you know, the Metropole Hotel in Hong Kong, and then spread through the various well-known cities, okay? And that, but then you could also consider the case of Ebola, because it's very interesting to consider the case of Ebola spread, okay, in 2014, 2015, because Ebola is often thought of as a disease of poverty. And it's interesting to look at the spread of Ebola, because Ebola started from a sort of very rural area at the juncture of certain West African countries, and it spread to poor farmers and poor hunters, okay? And then from there, it spread to the informal settlements in many of the capital cities. Now here's the thing, okay? Many of the residents or some of the residents in the informal settlements in Africa, they work as you know, drivers, security personnel, cooks, and maids for people in the rich areas of the city. So the people in the rich area of the cities became exposed to Ebola too. So the disease spread from the poor to the rich, okay? But COVID-19 doesn't have that spread. In fact, in Africa, the spread of COVID-19 goes from the rich to the poor, because it's only upon the people in Africa who have the means to travel to conferences in Europe and in the West, who contracted the disease there, who would take it back to their homes. And then when the personnel, like the maids and the drivers and the security personnel and the cooks would come to the homes, then they would get the disease, and then they would spread it to the informal settlements. So the disease with COVID-19 spread from the rich to the poor. So again, you can start thinking about the inequalities of the global north and the global south. The trajectory of the spread is revealing in terms of inequality, okay? And once again, this is sort of the research Roger and I have been doing. On the left is a West Point informal settlement. On the right is in Freetown, an informal settlement called Dvorak. And the thing is, in these crowded conditions with poor sanitation, who can practice social distancing? It's impossible. And yet they still had a very effective response to Ebola for reasons I can't get into here, but it deals with community-based involvement. There's also inequalities associated with social class in the ability to practice physical distancing, right? Here you can talk about the precariat and the essential workers, and who are the type of people who can work from home, right? Who has access to the internet. And these issues have arisen because you know that there were breakouts in meat packing plants, okay? Well, certain people don't have the luxury to work at home, and they have to go to work, and they have to go to work in crowded conditions, right? So this has raised a lot of issues, including the possibility for universal basic minimum income. You know, I'm sure that you've read about that. Inequality in terms of housing. The COVID experience has revealed the big gap that's always existed between landlords versus renters and the ability to pay rent, right? Housing market trends, you know, in recent days, this is kind of surprising and in a ways upsetting because it shows that there's a trend that people are leaving the condos in Toronto to seek out houses in the suburbs. Okay, and so the price of housing has gone up because under physical distancing, the people who can afford to do that said, well, I might as well live in a more spacious place in the suburb, right, instead of a tight condo, right? Housing, of course, is related to First Nations reserves and outbreaks there, okay? The question of transit and mobility issues, Lisa Saller, a PhD student in the social department, is looking into this. You know, with the COVID experience, there was a cut in public transit, right? But what this has basically meant is that more and more people are crowded into less and less buses, for example, right? And yet these are the very same people who must travel to go to their work. And it's issues of social justice, which, Roger, for example, has dealt with before. So anyways, we return to the question of agency and who can practice physical distancing. You could also look at the axis of age, the younger versus the older, you know, boomers, Gen X, right, millennials, and Gen Z, right? So if you look at the younger people, right, the Gen X or millennials and Gen Z rather, you know, what kind of jobs are they mostly in? Entry-level jobs in the service industry, working as waiters or waitresses, or in bars or baristas, and so on and so forth, right? And you know, you oftentimes are forced to make their wage so that they can afford university or college or what have you, or just to get by. So they're forced into certain crowded conditions at time too, right? Now you look at the other end of the spectrum, and you look at the elderly people. That's Samantha has looked into and has done a very nice presentation about the plight of the elderly. But one thing that you could also consider is who is taking care of these elderly in these long-term cares. And if you look at it, as Pat Armstrong does, you will see that the staff are oftentimes visible minorities, you know, Black people and brown people, low-wage people. You know, they've increased the wage a little bit. But again, these are the people who have to go to work in these places, right? The elderly people have to live in these places. So again, I asked the question, who is able to practice physical distancing based on agency and the assumption of agency? Now you look at, you know, my generation, right, which is Gen X, right, you know, and we're the sandwich generation, right? So my children go to school, right? This increases the chance of exposure to me. I also have to take care of my elderly mother, you know, which I'm happy to do, but I endanger her because of the exposure I may get from my kids, right? So what agency do I have, right? I'm structurally locked into something. This is a form of inequality as well, right? So to end off then, you know, there's a classic dictum in disaster sociology that studying the extreme, the exceptional circumstances in order to understand the everyday life. Because what remains latent during routine life becomes revealed during exceptional times. So it's no accident that the ugly head of racism rears itself, emboldened by certain political conditions in the US, particularly the president. I'm going to be explicit about that, right? Emboldenment leading to anti-Asian racism, anti-Black racism, for example, also anti-Muslim racism, where in India, the Modi government and the Hindu nationalists are blaming the Muslims for COVID, allowing white supremacy to take hold, right? The exceptional circumstance of COVID has revealed this underlying current, right? So COVID, if you want to look at the plus side, as progressives will do, it reveals the plight of the vulnerable, right? And Ulrich Beck, the famous German sociologist, talked about reflexive modernization, that the global environmental crisis will force people to rethink how they live, right? That was what he thought. But I think perhaps it's not a global environmental crisis alone, but it's also this pandemic that is forcing a lot of rethinking, exposing a lot of vulnerability. The question is, will this lead to action, change? Is there a chance of hope in all this, right? That's open to question, right? A lot of the stuff that I've published with Roger and others on Ebola and COVID are available on this website. That was just put up several months ago. So if you get a chance, please look at that. Okay, thank you very much for your attention.
Thanks very much, Harris. Thanks very much to the three speakers for bringing us such a rich perspective on the multiple dimensions of COVID-19 within and beyond the Toronto region. We're going to go up until 2:30. Professor Keil will probably have to go at around 2:20 or thereabouts. But we have about roughly 20 minutes for questions. If you want to use the chat function, you're welcome to do that. Another option is to use the raise hand function on the participants list, and we will monitor that. And then we'll find a way to unmute you. We have a raised hand from Ayman Alwida. I hope I pronounced your name correctly, Ayman. So we'll try to find out how to unmute you so you can ask a question.
Oh, she's just gone up and out of the picture.
She?
Yeah.
So
perhaps go to someone else and come back.
Or if any of the panelists want to speak to each other, have a question for each other, that's also another kind of way of thinking about it. I mean, there were many things brought up in the presentations. The issue of the poor, not only in our city and region, but the poor as a kind of a global entity themselves, the circulation of migrant laborers, and the vulnerability of particular populations. And it made me think of, for example, years ago, that book that Naomi Klein wrote, Disaster Capitalism, if I'm remembering it correctly.
Yeah, shock doctrine, yeah.
Or shock doctrine, is it? And that was after the Iraq War, if I'm not mistaken. And I wonder where we're at where are we at now in terms of this idea that governments can use epidemics or pandemics as a kind of an opportunity for looking for different types of opportunity. We're also living in an age of, I guess we could say, anti-democratic kind of forces in different parts of the liberal democratic West. And I wondered what your thoughts were on that as well, in terms of how those things are mixing in this particular juncture. Anybody wants to speak to that?
Yeah, I mean, to address this question, you really have to bring in the whole idea of neoliberalization, right? Because Naomi Klein's thesis talks about that, how a disaster sort of shakes things up so that the neoliberals can implement their policies like privatization, deregulation, downloading of responsibility to lower levels of government. Some of these things you already see. You see that in the United States with all the downloading to the state level into the governors, right? And then Trump criticizing them, right? You also see that in Canada in terms of who has power, jurisdiction over health in terms of the provinces versus the federal level, right? Has this led to talks of privatization and deregulation? I don't think yet, because we're in the midst of the pandemic right now and certain other urgent matters are being faced. It will be the time to tell when the pandemic ends, whether it will be used for an opportunity to, the COVID pandemic will be used as an opportunity to introduce such neoliberal principles. So that's what I would say.
Thank you. Anybody else?
Yeah. At the same time, I think that if I may just add to that, it's of course a neoliberal story, and it's not a success story, despite the fact that now, even here, as we could see through the presidential debates in the United States, as we can see through the attempts of the conservatives in Canada to find virtue in neoliberalism, even in this particular crisis. We also need to think about generally how democracies work and how the federal system works, how parliamentary democracies have worked in these crises. And there's another project I'm involved in with Ahmed Alawala at the University of Toronto, and two students in the MES program, Nigel Carvalho and Jenna Rich. And we're looking at a comparative study of Germany and Canada, and which are both federal countries, and to see, and in both countries, in one there's a liberal government and the other one is a conservative government, even though Merkel is probably more social democratic than most social democrats are in North America right now. Is that attempts are being made to bring back some kind of Keynesianism, another form of capitalism, and that can also be difficult, dangerous in many ways, because it brings back illusions about a golden time before neoliberalism, when everything apparently worked. But of course it didn't work, because it came with particular exclusions of women or people of color from labor markets, where the social welfare state was skewed against the weak and the poor in much the same ways as it was the case later. So we need to problematize those kinds of things, even though I totally agree with Harris, that this particular crisis that we're experiencing right now is a crisis of neoliberalism.
Thanks very much, Roger. We can go to Ayman, if Ayman is able to.
Yeah, thank you so much, William. Thank you, speakers, for all the beautiful presentation. It's just like, as I'm listening, I see that from my background as an architect, by the way, I'm professionally trained and practice architecture. And I did my research, or my PhD research, mainly on affordable housing, and then the gender spaces. And what I'm looking here is about, in your research backgrounds, talking about health, space, and placemaking. And this is mainly an architectural issues, and especially when we talk, for example, when Samantha is talking about 4 people in one room, there is a lot can be done through architectural designs and philosophies and theories of design, of flexible design and adjusting to diversity and inclusivity and all those kind of things. And I see that absent and in the social responsibility of architecture during this time of COVID-19. So I'd like to extend the debate and discourse to intersect or to include also architectural concepts into the debate. And I come from the global south, and I'm newly immigrant to Canada. And then all the issues about talking about how social distancing can be practiced in informal settlements, it's a big challenge. But also there is something positive to that I have seen how the social dynamic in the global south, taking care of the disease and whatever, there is a lot of support system in that system, how the Ebola have been combated. And we can also talk about AIDS in Uganda, for example, that have been a role model in combating AIDS. And it's only about social networking and support system, which is somehow, I would like to say that is not so much with the same intensity and this individualistic kind of of social practice in the global north. And this will bring me to another thing, that when we are talking about globalization, political decisions, opening Canada to immigrants, for example, immigration, and how now when we talk about urban social structure, now a lot of diversity, a lot of, really, I live in Mississauga and I can see that. It's really Brampton, Mississauga, there is certain social groups dominating maybe. So we have to look at that composition, but there is a component that is, I feel like, hinted upon, but not really addressed gender, which is the gender, that this epidemic, how is it across women and men? And then their intersectionality. In terms of age, in terms of race, in terms of all kinds of things. So the gender component is a very pertinent issue, that it's high time to come into the debate as very strong component, that and how does all that fit with the sustainable development goals, with the sustainable development goals, and the one that is leading the discourse on urbanization, on affordable adequate housing, on diversity and inclusivity of the cities. And so to speak about, we need to also reflect on, because this is the one that trigger all the political framework and all the global discourse. So how this COVID-19 now is affecting, we need to reflect, this is come out of the blue. So still people are drafting in the global south. I know they are drafting their policies and their frameworks because they need to receive funds and they need to be sponsored from the global south. And now something come up where people are still lagging behind to incorporate it and shifting the way of focus and how to deal with these issues. So I'd love to see how that is coming into the debate, architecture responsibility, and then the sustainable development goals, how they need, because they're still leading the discourse up to 2035. So things need to go back to the drawing table, and we see how that is affecting everything, even the sponsorship and the funding and what can be supported by international debate. Thank you so much. That's my input. Any one of the speakers can respond to that. Thank you.
Sam, I'm sure you have something to say about that. I have a comment to make too, but I want you to speak.
Oh, okay. Thanks so much for your comment, Iman. And I 100% agree there is a role for architecture in how we design long-term care spaces. In Ontario, there are regulations about how you can build, and often these regulations stifle that kind of innovation that you're talking about. Whereas in retirement homes, there's a little bit more flexibility about how you can build places. And a couple of interesting models include things like pod living, for instance, where it's actually like 4 or 5 people around a centralized location with caregivers that they know over time and they remain the same. And then if you need to go into lockdown, you can lock down that pod, so to speak, as opposed to the whole home or locking people into their rooms. And so absolutely, there's a huge role for that. And I would also agree with the gender component. It's massive. I don't have kids right now, but I know a lot of women who do, and they are doing, all the Zoom things with the kids. They're teaching, they're caring for aging parents, and it's disproportionately affecting women. And they're falling out of the workforce. And I believe the phrase is, it's like a feminist recovery is needed, right? Because those are the kinds of things that are coming to the forefront. And I know we don't really have a lot of time, so maybe I'll pass it back to Roger. He's going to say something.
Yeah, I just wanted to put a little bit of warning in there, and I really appreciated the question and also the comments about sustainability goals and the responsibility of architecture. I really appreciate this conversation. I just want to say that if we do that again, and I say again because it was done 100 and some years ago, that architects, particularly modernist architects, did exactly that, and they destroyed some of the older cities. I mean, starting with Baron Haussmann, of course, in Paris, the idea that you can build yourself into a healthy city out of the medieval city in Europe, and then also to build the healthy modernist cities in North America, in the settler colonies. This idea that you can build a new world is not new, and we need to somehow de-link this sort of modernist heritage of building the new from the message that came with it, which is that the old or the experiential, that world in which people actually live is less worth than the world that we're building. So we need to build in this ethics of repair that I was talking about earlier. This is what I meant, exactly that any new design now needs to be, needs to acknowledge the fact that we live already in a world and we cannot tear that world down. We cannot be in another world. We are in that world, and we need to harness the community knowledge and expertise in what it is like to live in that world, in rebuilding and redesigning those kinds of spaces. And I think this is what the moderns didn't do very well, and the postmoderns didn't even care about that. But now, as we're in the 21st century, we don't have to worry so much about the moderns and the postmoderns anymore. Perhaps we can find new ways to connect the experiences of a place like West Point, West Africa's largest slum, to gain some of the experiences from that, to learn from those experiences, how people under such dire circumstances live together. For the suburbs of Toronto, what can we learn in terms of community coherence? How can we design our spaces better? I think this is the kind of world we live in now, and we should learn from this moment that we are in right now, in which we actually live in that same world, which the moderns did not. They just went elsewhere and built places for people that they were not. So I think that is my appeal when we have this conversation, that we're not getting stuck again in that dichotomy.
Thanks very much.
Maybe just,
oh, go on.
I was just really quickly to add to that, Roger, is the importance of asking, like, and you're on it anyway, is the importance of actually asking people how they are remaking their world to be a place that they can live in. Because people who are living in these places often have fantastic ideas because they are living it, as opposed to like the outside designer. And I think it's the role of the architect, the planner, to really meaningfully listen and co-create solutions to the things that we're facing.
Hi, I have one comment about these public health information and communications. And I feel that if we have done our work, like in terms of studying the former outbreaks like Spanish flu, for example, we could have gone way easier and could save a lot of money. You know, from the early days, they started talking about the social distancing and saying 2 meters is like a good space, like a good distance. What we know that if someone sneezes or coughs, it can travel up to 6 to 8 meters. And the only thing that can prevent it is wearing a mask. And then later we had some videos coming from the Wuhan doctors explaining how it could spread within an indoor space, something like an airplane. And we knew from March that it was airborne, but public officials still stuck to that thing that don't touch, wash your hands. We know that it can also be transmitted through touching and falling the airbornes here and there. But if we have, and even now, like a couple of days ago, Doug Ford said, if you can't keep your distance of 2 meters, keep your masks on. But this is all wrong information. You know what, these viruses can be suspended in the air between, I think 6 to 13 hours or 3 to 13 hours. I can't recall the exact number. So if you're walking in the street and it's a crowded space and somebody sneezed, laughed, or talked loudly or moistly, the virus is still in the air. And although no one is around you, the virus is there. And then you take off your mask, breathing comfortably, and you are just inhaling the whole virus in. And then we are kind of wondering why people are getting more and more, because they think, okay, I check my hands, one hand right, and okay, I have the 2 meters distance around me, I should be fine. Or they go to a supermarket because nobody's there, or to the park they think it's safe. But the truth is, it's an airborne disease, and we have to be careful that we only need to keep our masks on and try not to touch different spaces, and try to make sure that we have clean, fresh air coming to our system. So all those, I mean, I would, if I was in authority, I wouldn't open the schools without first fixing the ventilation problem. I mean, when you don't have fresh air and people are breathing the same air over and over again, or in the buildings that they have air force systems, they just flush out the air once a week. So this is the whole serious problem that we should think about, but people are still thinking about 2 meters distance, don't touch this, don't touch that, while they should tell them, keep your mask everywhere on, everywhere, in the street, in the park, in your home, everywhere. I mean, not in your home, obviously, if you have the fresh windows. I mean, you have windows, operable windows, you can open them, but you should be sure that if you're going to the corridor, if you're living in a condo, you have your mask on, because corridor, again, is a contaminated space. Thank you.
Anyone like to respond to Negin? We're down to Ryerson and Samantha now, so either of you want to build on what Negin has just said?
Yeah, I mean, I think what you said is exactly right. I think you have to implement more stringent measures, which is more complete isolation, which is very difficult to do. But I think you're absolutely right. Yeah.
Sam?
I agree exactly what Harris said. You know, those are the things we have to do. And I mean, I think this morning Doug Ford was having his meeting with the cabinet. So I think we'll look forward to hearing what they end up to say to do. But I'm with Megan.
Oh, thank you very much. If we have no further questions, given that one of our speakers has had to leave to go teach, it might be the right time for me to thank the three speakers for their contributions, for stimulating us, hopefully not causing us too much anxiety. I'd also like to thank our coordinators for the session, Ellen and Tiffany, for their assistance. And I'd like to thank you all for being part of this and participating in the audience. Have a great Canadian Thanksgiving weekend, everybody, and please stay safe.